Welcome to another episode of The Last Zebra. I'm your host, Ugo Ezema, and I have the absolute honor of having Dr. Raven Jackson, PharmD, as my next guest.
Pleasure to be here.
Thank you. Thanks for being here.
Of course.
How have you been?
I've been good. Been good. Wrapping up the semester, so things are going well.
So it's really cool because you came about as a potential guest because obviously my very first episode was with my cousin and their brother cousin essentially, but he's also a pharmacist.
Yes.
And I met you through some mutual friends, some really great mutual friends. Shout out to the Gaddises.
Yes, good people.
Great people. And I was really, really interested to hear another point of view on what it's like to be a pharmacist in today's world.
Yeah.
But first of all, tell us a little bit about yourself.
Sure. So I am from a small town near the Opelousas area. I'm from Palmetto, Louisiana. I went to Xavier University, graduated from their pharmacy program, and did a 1-year pharmacy residency after graduating at Purdue University.
Oh, wow.
Yep.
Purdue Boilermakers?
Yes.
Drew Brees. I think Drew Brees went to.
I wouldn't know. I can't confirm or deny.
It's all good.
But did that residency, was a manager with Walgreens for a little while in the League City area. And then I've been a professor at Xavier since 2016.
That's amazing.
Yep.
And how long have you known that you wanted to be a pharmacist?
So I initially didn't want to go to college. My initial plan was to join the military.
Wow.
Air Force specifically. My family had a lot of history in the military, various areas within the military. And yeah, I was like Air Force bound, and my mom had other plans my senior year. And so it was a program called Upward Bound, which is like for kids who are first generation college students to expose them to higher education and college. And that was when I first got introduced to Xavier, went on a tour. I want to say maybe my first time in New Orleans.
Wow.
Didn't know Xavier existed. And yeah, I got paired with this pharmacist in Opelousas who had went to Xavier, and he was just this amazing man. And yeah, he was like, if you decide to do it, I think you should go to Xavier. And I was like, well, I'm not really interested, but when the decision had to be made regarding a college, it was a pretty easy choice.
Right.
So I chose pharmacy and kind of stuck with it.
That's impressive. Why military? I know there's family connotations, family influence where that's concerned.
Well, at the time I wanted to be not a graphic designer. I wanted to be an artist, but I wanted to specifically design airplanes.
Wow.
Yeah. So I took like a drafting design class in high school and fell in love with it. I always liked to draw as a kid. And so my mom, she let me have this passion for a long time. And then when it was like senior year, she was like, yeah, we need you to figure out like another choice, because the military is not it. So when I had to change from that, it was like, well, if I'm not designing airplanes, and I only saw myself doing it in the military, like in the Air Force. And I like the structure of the Air Force. I like the, what comes along with that, and just the security job wise and afterwards. But when I realized I wasn't doing that and I had to go to college, pharmacy was just like an easy choice.
Right.
It made sense. I was strong in science, strong in math. And it was like, okay, this should work.
Do you still draw?
I don't.
No.
No, I stopped. I never picked it back up.
Wow.
Yeah.
Wow. Would you ever? Do you think it's something you might read?
I'm more so into crafts now, so I do a lot of like crocheting and like a little bit of knitting here and there. So I think I've just stayed in the art space, but just switched up a little bit.
Nice.
Yeah.
Is there a part of you that if you could go back, would you make that same decision again?
So I don't know, because once I got into Xavier undergrad and I was getting ready to go into pharmacy school after my second year of undergrad, I was like, okay, I could either go to pharmacy school or I could enlist. And then I learned that I could probably enlist, but still like finish pharmacy school and, kind of do it that way as well. But then I heard about the entrance exam and the physical assessment. And at that time, I was like, I don't think I could even pass the physical exertion test at that point. So it stopped being a thought in my mind. And the older I got, the further removed I got from it. At this point, I don't think I would change or do anything differently. And I for sure don't think I would. I don't know if I would change, if I would go back and change knowing where I am right now. It was a good choice.
Oh, good.
It was a good choice.
Well, that's actually really refreshing to hear, because a lot of times especially when you've shifted so drastically from something you're passionate about, I find it very impressive that you're able to kind of switch that passion now to exactly what you're doing now. I don't even know if switch is the right
I don't know. I think I just refocused. Like, I think I just found another focus point, and I can see the value in the choice that I made. I can't be upset or say I would do something different just because as a 17-year-old, I like to draw. So
that's really cool.
I'm happy with it.
And we had a brief conversation before this started before the beginning of this podcast about how it's unbelievable to me, and I think we share the same view here, that we thrust the idea of making your career decision to 17, 18-year-olds in college.
So young.
And it's a good thing that we have parents, and I feel the same way now. Before, I've said this now probably on every episode, I always felt kind of pressured into medicine. Yeah. But I'm thankful that I have
absolutely.
the parents that had the oversight, the tremendous insight, patience to deal with. Absolutely. Obviously, me resisting that for the times that I did resist it.
My mom was not. I didn't have anyone in my family in healthcare.
Oh yeah.
And so my mom, when we were talking, you do these not entrance exams, but these assessments in high school where it's like, oh, you're strong in this and this. You should probably think about being this, and this.
Yeah, yeah.
And so every time I took those tests, it was like, you should probably be a scientist or a doctor or, a pharmacist or something along those lines. And my mom, she would just say, hey, remember, like, you're really strong in these areas. So pick something
in that area
that aligns with these areas. And she was like, that you being strong in these two things can take you really, really far. Like, you work hard, you like school. She's like, use all those strengths. And she's like, you could do 6 years of college. You could do, longer than that if you want to. So she always encouraged me to lean on my strong suits, which as a young kid, I didn't even think about, the fact that I'm strong in science and math, that should be my career.
Right.
But she had the foresight to kind of put me on that path. And it was never like, you have to go to pharmacy school. It was like, you have to do what you're good at.
Right.
So.
Shout out to mom.
She's pretty great.
Shout out to mom for real. Your mentor, is he still the one that exposed you to pharmacy? Did he or she? Did he go to Xavier as well?
He did. He was the first pharmacist I ever met. I had no relation. I knew no other pharmacist before this man. And I met him at like 17. And so he went to Xavier many, many moons ago. But he gave me my first job in a pharmacy as a cashier. He mentored me, through pharmacy school. He has been amazing. I actually saw him about a month ago at a wedding back at home. And he was just the greatest. It was an engagement party. But he was always been amazing, always been super supportive. And still he's like, if you ever need anything, let me know. He's not even practicing anymore. But he's been great. And
I know you've kind of been in different aspects of pharmacy. So obviously in retail pharmacy, and I'm learning so much about pharmacy over the past few, months really through this kind of exposure. I think as physicians, and maybe I'm just speaking for myself, but we're not really exposed to the different styles.
And there's so many areas of practice. Many.
We're not exposed to all these different fields. And I just learned about clinical pharmacy through my residency training, where I was starting to see pharmacists in that setting. Yeah. I had always thought of pharmacy as just kind of community-based pharmacy, retail pharmacy. Sense. Right. And you've dabbled a little bit in all these different
in a
fields.
Lot of them.
Yeah. And like I said, I spoke to my cousin, Randy. I said Randy, but Eke, the Kachi Eke, and he is actively practicing right now. Yeah. And he has a very negative is not the right word. His view of pharmacy is kind of jaded. And it was very jarring to me to hear him talk about it in that way. Yeah. And one of the biggest takeaways I got from it was he wouldn't recommend someone to do it. And he's even thinking of going back to medical school.
I heard that. Yeah. I heard that.
How do you feel about that?
So I'll go back and I'll talk about like the different areas that I've been able to practice in. So my residency was very much so retail, community based pharmacy management and teaching. So I did a Walgreens residency in conjunction with Purdue University.
Wow.
And so I got to see retail pharmacy from a management lens early on. I've always liked retail. I like the hustle and bustle, the fast pacedness. Like I love all aspects of it. So I knew that was a component early on in my career that I wanted to stick with. When I finished my residency and moved to League City, I became a manager of a Walgreens there, and everything about it, absolutely loved. It was crazy, just like taking over a new store, very young, having to train a new staff. But it was where my passion aligned at that time. And so getting the job at Xavier and having to switch over, I moved into clinic work. So I became a clinical pharmacist and did a lot of diabetes education from a hospital, clinic, ambulatory care kind of sense. I did that for a long time. It still worked for Walgreens, PRN, like as needed. And only recently, I was like maybe 2 years ago, I decided to start working in hospital, PRN. And so I did that, shifted out of retail, PRN, moved into hospital. And just because it was like I wanted to add it to my CV, interested in that area of practice. And it scared me a lot too. Like I've always not been a hospital person. I've been community for so long. But I think the fact that I have been able to see so many different aspects of the field, I've never got an opportunity to get too frustrated or too bored.
That's a great point.
With it. So yeah, I know my viewpoint is going to be different because I work primarily from a clinical aspect. I still manage and see patients via telehealth. That's what I primarily do now for chronic care management. So my touch point with pharmacy is a little bit different. Even when I was working in hospital, which I've only stopped working as of July. So up until then, I was working PRN in hospital. I still was only working a few shifts a month. So I would come in and I'm like, hey, let's do it. And people have been working 5-6 days straight for 10 hours a day. So it's just a different scope.
Right.
I haven't had that level of intensity in working in pharmacy like full time since 2015. So yeah, I think my viewpoint is just a little bit different. And as an educator, I also see the practice differently.
Right.
So I'm always going to advocate for it.
Absolutely.
Because, I see the value in what we do. And I think it's important that we recruit people who want to go out and do the work because it is important work. I've had patients who have said, like nobody ever explained this to me like this. Like this changed how I see this. This has changed my life. I feel like I can do this differently now. And you're going to have a whole lot of craziness that comes about. I worked a little bit in retail during the COVID pandemic and in hospital throughout the COVID pandemic. So I got to see it from two different sides, but I can't parallel my experience to the experience of someone like your cousin who was doing this every day.
Right.
And my best friends who work in pharmacy, who've been doing this every day. It's not the same. So I know that there's a ton of work that needs to be done. Like there's from legislation to, how we support ourselves within the field, how we stand up for each other who work in different fields. There's a lot of work that needs to be done, but I'm always gonna advocate for it.
You're like you said, you're an educator,
yeah,
especially an educator in pharmacy. And I have a special place in my heart for anyone that ventures into academia, education.
Yeah.
You have to be a special person. You just have to be.
It's a lot.
Truly a field that requires passion if it's going to be done. And it's one of those things that if it's going to be done, it 100% should be done right.
Yeah.
I wanted to double back on what are the big differences that through your experience, of course, the biggest difference between community and inpatient clinical pharmacy.
Can I do community, clinic, and hospital?
Oh, yeah.
Okay.
Yeah, 100%.
So across the board, as pharmacists, we're expected to be medication experts.
Yeah.
So we should know what drugs might interact with what other drugs or patient conditions, age, all those different things. So we should be able to see and identify medication-related problems. I tell my students all the time, we are to be investigators, problem solvers, and we should speak the language of medicine. Now, if I'm in retail, if I'm in clinic, if I'm in a hospital, those medications are going to look very different. In retail, we're talking about more chronic care or like quick acute care type OTC, type things, immunizations. That's that space. In my clinic work, which I do via telehealth, it's mostly medication therapy management, which I see patients who are on 10 plus medications, sometimes up to 20, 25. And so there, I'm really trying to spend a significant amount of time talking to these patients about, do you understand your medications? Do you understand how to take them? Do you understand, can you afford them? All of the things that make someone more well. I don't always have that level of time in a retail setting. So that's a difference. And then in hospital, I don't really talk to patients. I'm really just consulting with providers, nurses, other practitioners, and I'm receiving orders. Now, depending on what floors I'm working with, those might be mostly IV orders. They might be mostly PO orders, post-surgery orders. So it's different because my population of who I'm servicing at the time is different. And so I would say, depending on what your strong suits are and, what level of patient interaction you want to have and what level of rounding do you want to have, like all of working in the interprofessional team or working more so in like not a silo, but, where you're kind of steering the pharmacy ship as you do in retail, is different from setting to setting.
Right. That's pretty awesome. That's well explained. Polypharmacy, you kind of brought that up. I was lamenting to a colleague of mine that I wish there was a way that we could have a consult for polypharmacy. And telemed would probably be the best way to do it. So if there's a way to, because so many if there's a way for someone to reconcile these medications, so many medications are redundant or repetitive. They do the same thing. They can be combined. There are many different ways to alleviate the burden. And I think it's an under-recognized contributing factor to patient and patients not being compliant.
And hospitalizations.
Right? So all these adverse reactions that come in,
a lot of them could be resolved
simply by just addressing that. But I also don't think we as providers as a whole, a lot of us don't have the time. Most of us don't have the time to actually sit down.
Especially when you have someone with 27 medications.
There you go.
Yeah.
A lot of times, exactly. A lot of times we don't have the time to, and we really should have the time to kind of go through all of these things.
That's a visit in and of itself.
Yeah. And then the other thing is, a lot of times we don't have the education or knowledge to be able to go through all of these things in kind of detail. I imagine that you have to do whenever you're doing these telemedicine visits.
We do. And that's one thing that we train our students on in pharmacy school, is how to look at these long lists of medications, because it's different when you're looking at diabetes and hyperlipidemia and hypertension, and you're looking at them separate. But when you have a patient who has all three plus a little lanyard, and you have, that medication list, it adds up very quickly. And we are trained to learn how to identify and see like, oh, this and this automatically feels like a problem to me. Or why is this dosed 3 times a day when it could be dosed twice a day? Because I know they're not adhering to that middle of the day dose. So medication adherence and medication knowledge and collecting a medication history is a skill. And that's something that is taught within the pharmacy curriculum. But again, regardless of where we work, we should have that trained eye to like find those particular problems, whether it's 8 meds or 27. Now, it's of course going to take more time, but yeah, that's one of the biggest issues I see, are discrepancies in medication lists.
How long have you now been in academic pharmacy as a professor? Right?
This is my 8th year, 7.5 years. 7.5 years.
Wow. And was that something you foresaw when you started out, or was it something that, you kind of embarked upon and is growing on you? When I started pharmacy school, I knew I wanted to be a pharmacist, and that was it. I had no clue about where, what, how, I just knew when I graduate, I want to be a pharmacist. And so when you get into like your second year
people start asking questions. So like, what do you want to do? I know I want to do this. And I didn't have an answer to that question. And I started to panic because I felt like everyone around me knew and I didn't. So I went to my mentor, who was, I forget what position he held at Xavier at the time, but he was in the College of Pharmacy. And I went to him. I was like, I don't think this is for me. Like, I think I made the wrong choice. Everybody else knows what they want. I was like, I don't have I just want to do good work and know a lot about drugs and help people. And so he looked at my resume and he looked at it, he closed it. He was like, you should be a teacher. I was like, what do you mean? And he's like, you've been tutoring and mentoring and doing all of this work. I was a research assistant, not a research assistant. I was a research methods tutor in the college when I was in school. I did some work outside, like tutoring around the city of New Orleans. And he was like, obviously you like teaching. You should be a teacher. But I didn't see that career path for myself. And then I started paying attention to teachers around, like in the college, who were young, who kind of looked like me. And I was like, well, they're doing it. So I just slowly the idea started to kind of come into fruition.
Yeah.
And in my third year, I talked to him again and he was like, well, if you want to teach, you have to do a residency. So that's one of the caveats of teaching is that they require at least 1 year of postgraduate residency. And I was very much so anti-residency at the time because I just wanted to get out into the field and do my job. But he said it's a small price to pay. You can do a residency in retail, which is what my interest was in. And he was like, that'll set you up to do what you want to do. So I was able to do the residency, and then I still wasn't ready to go straight into academia.
Right.
I wanted a little bit more like foundation in working and managing a store. And so that opportunity came up. And so I took that. And when the opportunity to teach at Xavier came, it was a year after I became manager, like almost to the date. And I was like, am I ready to leave my store? Because I'd just gotten it where I wanted it to be. And I talked to him again. And that's the beauty of having good mentors. This man had pretty much followed me I was able to kind of stay in contact with him for 5 to, even now to this day, we still stay in contact. And he told me then, he said, you can always go back to retail. Like this position at Xavier, this is a one in a lifetime kind of deal. So he was like, I know you don't want to leave your store, but if you're leaving it in good hands, then you got to do what's best for you.
What's a research methods?
So we had a course. It was like biostatistics.
Oh, I love this.
And it was my favorite course. And so I was able to work with that teacher to be a tutor, research assistant in his course. So that was good. It was nice.
One of my casual pet peeves, especially around the pandemic, was just in general conversation whenever things came up about, whatever it is, vaccines, whatever it may be, was do your own research. And it's one of my own pet peeves. It's one of my pet peeves is that I strongly believe that most people don't know how to do their research.
I agree.
You don't know how to do your own research.
I agree.
So telling someone to do your own research, because what that means to most people is to go on Google and read somebody else's opinion on something. And that's not a well-formed opinion.
Absolutely not.
Not to mention the ability to discern, analyze, and come to your own conclusions when you read. And I'm not saying I'm good and great at this, right? But in general, to be able to look at a scientific paper journal and to be able to discern and come to a reasonable conclusion using a well-understood framework. So whenever I hear it, I'm just like, you have no idea.
Yeah, it's way too high level of a topic for it to be so casually mentioned that you're like, oh, just do that. And it's like, well, that's people learn how to do this.
Yes.
But yeah, it's something else that we teach and train our students on, because you'll see a drug lowers A1C by such and such percent or 99% effective. And it's like, well, what are we talking about? At what? Yeah. And says who?
Right.
That information goes out there. Marketing is a big thing when it comes to drugs. And a lot of the stuff that comes back to us as pharmacists is, well, I saw this on TV and it said it does this and this. And then the finest of prints, of course, is like, contingent upon this and this statistical test. I'm like, nobody's reading that. But
yeah. I want to, at some point, whenever I have the time, I want to find a way to create something. I would make it free, even like a free course on how to do your own research.
Yeah.
And really it's just meant to let you understand how to read these kind of information and find out what's true, what's BS.
Yeah. And some stuff I would say that's an amazing thing. And I would still say that's super high level.
Yeah.
But there are things, as small as a drug facts label, the back of a box of Benadryl.
Right.
That, says to take one daily or to do this. And people still don't know how to read those serving sizes on food. You know what I mean? There's so much education that's needed.
Right.
Just across the scope of healthcare in general. So I think it's great that you want to take that on. That's a big undertaking.
Yeah, it's in my book somewhere. I'd have to. It will definitely take some research.
Right. Do your own research.
Yeah, it'll take some research into how to execute something like that.
Yeah.
Teaching.
Yeah.
Like I said, it takes a very special person.
Thank you.
What has that been like? You've been, like you said, 8 years in now.
Yeah.
What has that been like? What has been some of the I imagine there's a lot of personal growth.
It's so much.
Yeah, because in casual medicine, the way we're trained, and medicine is a forever learning endeavor, right?
Yeah.
So every year you have to keep up to date.
Same,
right?
continuing education.
Exactly, continuing education.
Yep.
More so in pharmacy, I think pharmacy changes by the day.
Yes.
By the day.
You are always behind.
Exactly. There's something new for you to learn. How are you managing? How are you coping with all of that?
Academia has made me a lifelong learner. So we had a professional development series today, and one of my colleagues spoke about growth mindset versus a fixed mindset. And you can't work in academia and have a fixed mindset. You can't effectively work in academia and have a fixed mindset. You have to have not even just a growth mindset, but a learner mindset. So I've become this lifelong learner because by the time I might mention a drug one day and it could be discontinued the next day.
Yeah.
One of the drugs that I see in my patients all the time now, I was on a call yesterday and it's like, oh, this drug is coming off the market in April. And I was just like, what? Why? And you miss one email and you're behind.
Yeah.
I tell my students all the time, when I graduated from pharmacy school, there are classes of drugs that did not exist. There was no mechanism of action. There was no drug. There was no treatment plan. It didn't fall into any guideline. And so not only does these drugs come about, but they also have a place in therapy now. So I have to be able to strongly recommend this to a provider and say, hey, based off of this literature and this research, I know this drug just got here yesterday, but you know what I mean? So like, I remember when certain drugs came about that are now, more popular, but it took years for them to kind of get acclimated or for providers to get adjusted to using those because we had these medications that have been around for so long. So not only learning the medications, but staying abreast of like these clinical recommendations that come along with them and being able to like advocate like, hey, like I think this is a good drug for this particular patient, but it's the continuing education piece and wanting to stay on top of it is important because you have to do a certain number of CEs for your license, but that is the bare minimum, I feel.
That's true.
I think in order to stay where you need to be in your profession, you have to do much more than that. So I have friends who work in retail and they specifically will do CE that's like related to their, different areas of the populations that they service. With me, I work a lot with diabetes, hypertension, hyperlipidemia. So January 1st of every year, I wait for the American Diabetes Association to drop their new guidelines. And that's one of the first things I'm reading in 2024. So, like those things, you have to kind of stay on top of those things that especially are pertinent to your area of practice. But even around me, there are things that are going on in psych, in oncology, in these spaces that I don't really touch as often. And you're not going to keep up with everything.
Right.
But when I see something that I'm not familiar with, my inclination is always to look it up. And I might not know everything about it, but I don't like for there to be too many drugs that I haven't heard of.
Right.
But they come about quickly. very quickly.
I can imagine. What is your, or what are your topics that you teach?
So depends on the semester. I teach interprofessional education, which I've been teaching since 2017. And I work with a ton of different schools around the nation, within the state and around the nation. And we talk about interprofessional collaboration. I also teach professional practice, which is a first-year pharmacy course. It's one of my favorite courses to teach because it's in the fall semester, first year. So I get them early. And my course goes over just basics of what it means to be a pharmacist, areas of practice, parts of a prescription, history of pharmacy, errors, things like that.
Right.
In the spring, I teach medication therapy management, which is pretty much what I do in my telehealth center,
Gotcha.
which is that overall comprehensive review of medication. So it is a skill. The students get a certificate training throughout the semester. And so I train them in that. And I teach a women's health elective as well.
Two of those stand out to me. Interprofessional.
Yes.
And again, I think a lot of the ignorance that providers have about the world of pharmacy is probably lack of that interprofessional relationship or communication. A lot of times our pharmacists, and honestly, I'm not making this up, but I think since I had that first episode, I would gladly say that the way I appreciate my pharmacist
is different.
It's very different.
Yeah, it makes sense.
It's very different. And I am much more attuned to some of the challenges that, just calling and saying, like, I don't think I ever did this before, but even if the thought entered my mind, like, why isn't the level fed here yet?
Yeah.
It's because there's a
there's a problem.
Yeah, there's something.
There's something that's because we want to get it to you as fast as possible.
Exactly. It's not because they don't want to do it.
Oh no,
never.
never.
You know what I'm saying? There's a lot going on.
Yes.
I wasn't aware of so much of those dynamics that go into, especially in that particular case, clinical pharmacy.
Yeah.
What that course? I assume it's the entirety of a semester.
Yes, it's the whole semester.
What's the breakdown of what that course is like?
So this course has morphed so many different times, and you had asked me a question earlier about what's something I've learned in academia I've had to be very humble in assess like my own personal self-assessment when it comes to my courses, and this course has needed to improve every semester that I've taught it. So I always tell my students, like, you're getting Dr. Jackson 2.0, 3.0, 4.0, because it keeps getting better. So like this iteration of the course doesn't look anything like it's looked before in the past. But one thing that we focus on is 4 interprofessional competencies, which I want to say back in 2014, 20 plus schools, institutions kind of got together and said, people who are working together should know these 4 things. They should have a sense of value and ethics, roles and responsibilities of the people that they're working with, a high level of communication, and then just like the basics of teams and teamwork. So we use those 4 competencies as the tenets of the course. So students, we get guest speakers in from various different disciplines. So I may be reaching out to you. Various disciplines. Thank you. And we have them do interviews with either healthcare professionals or students in healthcare professional programs. They have to do a group project on a different healthcare profession than theirs. And we do like mock cases with, we have a school that we work with, and we'll set up a time. The school has different healthcare professions than we have. So we kind of mix everybody together in these little working groups, and it's like a little rounding team. So we did an inter-hospital simulation earlier this semester, and it was probably maybe 10 programs and like 100 or so students who were able to break up. So it's always really nice when we can do those kind of like, I forget what they're called, grand rounds. Yeah, similar to grand rounds. Yeah. And so we come up with the case. We make sure every profession is represented in these mock cases. We get facilitators from the different programs to add insight. And the students always love it. Like they're like, wow. Oh my God, I didn't know that a PA did this, or I didn't know that an audiologist did this, because we've had veterinary, we've had
all sorts of
rad science, like we've had like a ton of different professions in our working group. So it's always really, really good. But the key takeaway from our interprofessionalism course is that the students learn from, about, and with different healthcare professions. That's the framework of interprofessionalism. What sometimes happens is that people get talked at, like this is my job, this is what I do, but you don't always get an opportunity to say, hey, well, this is what I do, or this is what I bring to the table. And it's important to know your role and your scope. Mm-hmm. And so sometimes things are outside of your scope, and it's okay to know that, because when you're working in a team, as for pharmacists, I don't administer a ton of medications. Mm-hmm. That's more so nursing. Mm-hmm. And so knowing who is responsible for what in the overall scheme of this patient's care is important. I don't prescribe. That's not my job, but I find medication problems. Mm-hmm. I verify orders. I make IVs. Like, knowing where you fall really helps you to be more confident in what you bring to the table. So the students, this is sometimes the first time that they get to meet a student who's in med school, or, talk to a physician or a psychologist. We have PsyD on Xavier's campus. We have a physician assistance program, and we have speech language pathology. We have public health. So we try to incorporate as much of those professions as we can in our interprofessionalism course.
That's amazing. Mm-hmm. I never had such a course in my medical school. And
I didn't have it when I was in pharmacy school.
Why? So I was about to say,
it came about around 2014 was when that shift kind of happened, or when schools started to integrate it. And from an accreditation standpoint,
wow,
a lot of healthcare professional programs have to have an interprofessionalism component now.
I think that's a major move. I think that's so awesome, because I think a lot of us aren't exposed to those to all the different people that we work with.
Oh, yeah.
And especially for doctors, because we're kind of thrust into like a leadership role.
You are. Oh, yeah.
And some of us aren't, necessarily ready for that. We slowly work our way through training and all that stuff. But in that context, it's within the framework of other doctors, right?
Yeah.
So, in residency,
you kind of mirror what you see. Yeah.
Exactly.
Makes sense.
Exactly. So it's really, really cool to have something that kind of gives you that exposure. It just humanizes everybody else.
Yeah. And I think you have a greater appreciation. Like you said, you learned a little bit from a pharmacist, and like when you have a encounter, it's like, oh, okay, I have a little bit more patience. I have a little bit more time. I understand kind of where they're coming from a little bit. So it helps. I know it's helped me from teaching this course. Even like I've been working as I've been teaching the course. So I've been able to kind of see and practice some of these different competencies, and it makes a huge difference. Now I will say that it affects more so the people who are going through the classes now versus the people who have already graduated. Like they're not getting that in the curriculum. So I tell my students, it's great that you're getting this training, but you're still going to work with a whole lot of people who have not. And so you might have this mindset of inclusion and, everybody has a place at the table, but there are many, many, many people who just do not have that mindset. And you're going to run into a lot of those people in healthcare. So,
because this is really just the beginning.
This is just the beginning of the influx of people who have that level of education.
That's really cool. That's really cool.
Yeah.
And then the second thing that the second course that you have is women's health.
Yes.
Was that I imagine at the beginning you probably started maybe one, and then you one of these courses, or how did you pick up which one you wanted to teach, and then how did you add on to that?
That's a good question.
And then how did you get to women's health?
Oh man, so I'm going to start off with the women's health piece. So when I did my residency, I had to pick an elective. Even though it was a retail teaching residency, generally they'll give us one longitudinal elective. And my longitudinal elective was on women's health. Always have had an interest in it. And I wasn't exactly sure about the other one, so I just kind of picked it, and I absolutely loved it. We ended up doing like a lactation policy with Walgreens in Indiana, so that workers at Walgreens would like have a space and what that looked like and all of the things. So it was a great opportunity. And so when I got to Xavier and they asked me about teaching, like, because with a lot of schools, you go in with a specialty and they'll place you in a specialty. I didn't have one. And so they were like, well, what additional training have you had? I told them I had women's health, but they already had someone teaching that.
Gotcha.
So my other area of practice that I kind of had more experience in was in specialty pharmacy, which was where multiple sclerosis and Alzheimer's. So I ended up teaching more so in the neuro space. I always have to credit Xavier as an institution, as a workplace, because they really have given me the space to do the things that I'm strongly suited to do and have been okay with me making changes. So my chair observed me for a while, and she called me in one day and she said, Raven, I really think you should teach in the first year course because I think you're really it's good exposure for the students coming into the college to have a clinical professor in their first year. And so I was like, okay. And so she was like, we're going to pull you out of neuro. And I was like, oh, thank God. And because I also never wanted to teach, like, I didn't think that neuro was my strongest suit, even though I'd had some exposure in it. I felt like I was better suited in diabetes or women's health or something like that. So that came about. She switched me there into professional practice. And then I asked, I was like, hey, I'd like to start an elective in medication therapy management. Is that okay? And she was like, absolutely. Get trained, start the course, get the students, enroll them, and teach the course. And so I've been doing that since 2018, 2019.
Wow.
And then with women's health, she kind of kept it in the back of her mind that I had this interest in women's health. And when an opportunity opened up, she called me and she was like, hey, if you still want to do it. And I was like, absolutely. So I have a great boss. I work for a great school that, really has done the best for me, I think, to keep me in spaces that I'm best suited to teach.
That's awesome.
And yeah, women's health, this is the most excited I've been about teaching has been like lately. I started teaching women's health last year. And so it's been a great course finally, like, to be able to get back into that.
That's amazing. When you started teaching, was it, because when I think of teaching, I think of curriculums, forming curriculums, classroom etiquette and certain things that I always assumed that you'd have to go into, because there's a whole bachelor's in education. Yeah. Right? I assume you didn't do that.
I did not.
So how did you start? So, and you're doing high level education too. Yeah. It's not, it's not like you're starting off in preschool, high school, that you went straight to high level education, even beyond tertiary education, right? So what was that like?
So most residency programs require you to go through like a year-long teaching certificate program. Oh. And so I did that through the Indiana Pharmacist Teaching Education Certification Program. I think it's called IPTEC. So we had to do that as a component of our residency. Wow. And that qualifies you to teach from a clinical, like in a clinical position. So we go through how to write test questions, learning objectives, managing a classroom with older learners. We really don't have many issues with that. The expectation is that you come to learn because you want to be here. But there is an art form to developing slides and creating test questions and assessing the value of these different questions. And I would say you have to stay in academia a long time to really understand the quality of an assessment. It is by far the hardest part of my job, is making sure that what I'm teaching you aligns with the curriculum needs, as well as you have to take a board test after you graduate. But you need to know beyond just that, and I can't just write a question because it sounds good. I have to make sure that it's impactful, that it meets a learning objective, that it meets a course objective, so that they teach us the very beginning stages of what that looks like, of what pedagogy is and what that means. And so once I got the job at Xavier, they give us mentors. So you get a faculty mentor who has been teaching for some time. And then I also went through an additional teaching certification program that first year. I chose to, I didn't have to, but I have a strong interest in teaching, in the actual practice of teaching. So I've read books and gone to conferences and training. So pharmacy teaching is its own thing, different than pharmacy practice. But there's a ton of continuing education and, conference and materials and things like that suited just towards teaching.
Do you do the clinical aspects, or when you're going to the hospital to do and the telemedicine, is that more of a break of pace thing for you, or is it something that you don't want to lose the skills? Why do you?
We have to. So as a clinical professor, the part of our clinical part of our title is the fact that we manage a site. So any clinical professor has to keep a site.
Wow.
And it's a partnership with the institution and the hospital or the clinic or whatever, that the pharmacist is going to provide this service, and the hospital allows students to train underneath those pharmacists. And so it's a win-win type of situation.
Right.
When I worked at a hospital as my practice site, I would go there in the mornings, and then I would come in the afternoons, and I would teach in the afternoons. And so, it was like a break in the day. But now, since my site is more remote, that I kind of switch between doing both very easily. So if I need to take a call for Xavier or whatever the case may be, I can arrange my calendar in a way that suits whatever I needed to with my teaching.
Wow. What's your favorite thing about what you do now?
Oh.
Well, maybe that's hard.
That is hard.
Well, then I'll make it harder. Top 3.
Top 3.
Yeah. What are the things that actually a good way to? I always like to think of it this way. What are you most excited about in the mornings when you think about your job?
I'm always excited when, let me think. So I do a lot of debates with my students.
Oh, that's awesome.
So I do debates with students on my rotation. I do them in my women's health elective. I love to hear my students talk about, like, defend their recommendation, to confidently say, I would recommend this drug, and I know I would, and this is why, and being able to tie in all that knowledge and to say it boldly. That would probably have to by far be my most favorite feeling, is knowing, like, I'm going to have my students debate today, and they may not love it, but just to hear them do the research and to stand firm and say, hey, like, I think this is a better drug than this.
Right.
And so that would be one. 2, I teach in a skills lab. So I teach students how to do HIV tests, HCV tests, things like that. And I think for them to see themselves in certain spaces, and like for such an important disease states, and to see them develop a skill and use a skill, and regardless whether it's in my skills lab or whether it's doing a blood pressure assessment or a blood sugar assessment or seeing them out at a health fair, to see them do the skill of a pharmacist, that is always like heartwarming too. And anytime I'm meeting with a student because they're like, yeah, I'm interested in, maybe interested in retail, I'm interested in hospital, and they want to talk about their career, and they're like first or second year, and they're really just trying to get insight. Anytime I have someone eager for their future like that warms my heart too.
The 2 things I wanted to kind of add to that was how you became a pharmacist was through that eagerness.
Yeah.
And somebody else identifying that. Has there been someone that you've seen yourself in?
Like a student?
A student, yeah.
I feel like I see aspects of myself in a lot of them. And sometimes it's not always, like, it's things I'm like, you're going to grow, like, you're going to develop out of this. And so one of them has been like just hesitancy and fear. And so I see students like, oh, I'm not going to apply for this, or, I'm not going to sign up for this. And I see it and I was like, oh my God, I was the same way, and I tell them all the time, like, you can only go so far if you limit, your exposure. I know it's not comfortable, as I would consider myself to be more of an introvert, even though I'm doing this, but I tell them, like, you'll find your strong suits outside of your comfort zone. But I see that part. And then I also just see passion in a lot of my students, and they really, really, really care about their patients. And that's the part too that I'll resonate with when I see someone who cares a ton, and they're like, well, why don't we just find like a coupon for them? Or why can't we do this? And I'm like, I love that you care so much. Like, this is good. This is going to take you far. And then the leadership piece is, another piece that I'll see in some students. And that developed in me probably in my residency. So I'll see some students in their second year, and I'll tell them, like, I didn't have this level of confidence in presenting until I was in a residency. So it's always nice to see some things and to see areas where I can say, hey, I was here and now I teach in front of you. So you may not like doing a presentation, but I'm going to keep making you do it because I know the value that has and where that can take you. So
what would you change about the field in pharmacy that you think would help alleviate some of those stresses that Dr. Eke had brought up?
He made a ton of amazing points. And one thing that I always ask my students on rotation with me is like, what do you see as one of the biggest issues facing pharmacy? And I can list a laundry list of things that I think negatively impact the profession. One, I think that we have to advocate better as a whole pharmacy practice. It can't be hospital versus or against community retail against clinical. Like we can't combat against each other and think that we're going to move the profession forward. So I feel like if someone's working in clinical versus hospital versus retail, we should all be advocating like, hey, this is too much going on in retail. We need to advocate for our brothers and sisters in retail. Or, hey, like this is getting crazy in hospital. Like we need to make sure this is for all of us, because at the end of the day, we're pharmacists. Right. Regardless of where you work, you're a pharmacist. So I think peer support and having one shared voice as we petition for changes in the field would be substantial. Another thing is there's a lot of conversation about provider status for pharmacists. So
what would that entail?
So provider status would basically be a way for pharmacists to be reimbursed outside of just dispensing. We get paid for the medications that we dispense. But when you work in clinical and you're doing like reconciliation and things like that, it's cognitive. There really isn't a good reimbursement model for cognitive services. And until that exists, we will primarily have to receive our reimbursement from dispensing. Provider status, then the term looks different for every person. So I think whatever that means, if it allows for there to be funds set aside for pharmacists to do certain things, and that certain pharmacists aren't getting overwhelmed by doing so many different things, I think it could be, some things could be alleviated in that manner. I don't know what provider status is going to actually look like. They've been lobbying for it for years, for as long as I can remember. But I think that for us to be recognized for our cognitive skills as well as our dispensing skills would be key. And if we had that peer support just across the board. Yeah.
So if someone was to hear the laundry list of the things, all these negative things that are impacting the field.
Yeah.
If a young boy or a young girl, a young college student hears all these things, and they had previously met you and they were enamored and they were like, I want to be a pharmacist, right? I met this passionate pharmacist who clearly cares about what she does. And then in their own, through whatever exposure, someone tells them, these are the things that, you should really think about before you go into pharmacy. How would you convince that person that they should be a pharmacist?
So,
knowing that they already have a passion for something like that.
Sometimes if students are unsure of what they want to do, or if they're fearful of just getting overwhelmed, I sometimes tell them to try and see if this is something that they want to do. So especially new pharmacists, I usually will say, try to work part-time in retail, PRN in hospital, or, vice versa. If you got to get your benefits, but see what you like. Some people like to be able to switch and do like a little bit more hours here, a little bit more hours there. I would say get in a position, and you might have to go through a tough period, but get in a position of leadership where you can make some substantial changes. I think sometimes we don't see pharmacists at the top of these organizations that make decisions for pharmacists, and they have no clue what's going on in a pharmacy.
Right.
I've worked with people who have not been pharmacists, who have been above me, and I've been like, come see what I'm doing so that you understand where my priorities lie.
Right.
I think we also, as pharmacists, and it's going to be more work, we have to advocate for better pay and higher pay for our pharmacy technicians. They save our behinds all the time. My sister's a pharmacy technician, and I know the hard work that she does. And if we could pay our pharmacy technicians more, they could do more. You know, you see this as a career and as a passion, and they would stay. It's hard when you have technicians coming in and out. It doesn't matter how crazy my days were. When I had a full staff of dedicated technicians, my day was smoother. And so I think, you know, we have to consider what that looks like to say, hey, this is a professional career. We want people who want to be in this field as a pharmacy tech, and we need people, you know, who can do those things, but we can't require so much of someone and then the compensation isn't there.
Right.
So I think those are a couple things I can think of, but it is challenging, but I think any career you go in is challenging. People always ask me, like, you know, do you think academia, like, did you pick academia because it's an easier choice than retail? When I was in retail, I loved my job. I didn't leave it because I didn't love it. I left it because this was a better choice for me then. Right. And so I would say there are going to be challenges regardless, wherever you go. I think healthcare in general, if you come into healthcare now post-COVID, you're making a choice. You know what I mean? And I think any area of practice in healthcare is probably going to be a lot, you know? So I think they have to understand that healthcare has shifted. And that, you know, things that didn't exist before exist now. And you make a choice when you go into healthcare to assume that responsibility of what that looks like. And it's adulting too. Like, you're going to have to balance some stuff. And yeah,
that's
that'll
awesome.
be it.
What does the future look like for you? So this is and I'm hoping, my daughter is only 4 and my son is only 1, but I hope to frequently ask them to think of themselves whenever I'm able to have a proper conversation with them. Yeah. Think of yourself a year from now, 5 years from now, and 10 years from now. Yeah. What version of yourself do you see at each of these junctions?
1 year, 5 years, 10 years? 1 year.
1 year is so. In a year's time, the newest publication from American Journal is about to come out.
In a year's time, I hope to make, have a better view of what I want my progression, my promotion to look like. I've been promoted from an assistant professor to an associate professor. So my next step would be full professor. And so I really need to start collecting my scholarly work and seeing what that looks like. So that will probably be what I move into next year. In 5 years, I see myself moving into higher administration. So I got my MBA last year in healthcare administration. Congrats. So thank you. And so, yeah, as I look at the curriculum, I'm seeing it from a different lens now. I'm more so in like hey, we should probably do this a little bit differently, or we've been doing it like this for this long, but it's not yielding what we wanted to yield. So I'm at a point now of assessing the curriculum differently with a different lens after 8 years. And so I can see myself in 5 years wanting to be more so having more of a hand in curriculum development and policy and things like that. And in 10 years, I don't know. Hopefully I'll just be at a point where I'm getting emails and text messages from students past who are like, hey, I'm teaching now, or I'm working here, or I'm, a supervisor at Walgreens. I just want to have such an influx of positivity of people who are happy that they're in the field. Yeah. That's what in 10 years, I want to just kind of like pick up my phone every day and see something positive about the field. Maybe higher administration from a career standpoint. But yeah, academia has been good to me, so I don't see myself leaving out of it too soon.
That's awesome. Do you engage in active research? Are you a researcher?
Yes, I am an active researcher. My research is mostly in interprofessional. Telehealth. Okay. But from a rural health perspective. So my main focus is to help to decrease the digital divide between those who have access to healthcare and technology and those that don't. And so I'm constantly trying to make sure that as telehealth goes out into rural communities, that is done so equitably and not in a way that's going to continue to further cause divide between those people. Because telehealth is great for rural areas, but it's not great if you don't have the broadband or the technology or the digital literacy. Right. So I have been finding pieces along the way that have shown me that there's much more work to be done. So that's another thing I hope to do in a year, start digital literacy classes in New Orleans and surrounding areas to get people more comfortable with, opening up your chart to see,
see what's going on.
To see what's going on, getting comfortable with just computers in general. So I'm going to partner with our computer science program, hopefully, and do some things. But yeah, just making healthcare better for people who need it.
That's awesome. Mm-hmm. What are your outside work hobbies? What do you like to do outside of work?
Read non-work stuff. I like to read. I love biking.
Really?
Yeah. I'm into biking. I don't love running, but I do it. I've gotten into 5Ks and 10Ks, and I think it's just like a adrenaline rush. So I'll train for a couple 5Ks a year, and I don't love it, but I do it.
Have you done the Crescent City?
I have done the Crescent City, and I've done Old Man River, done a couple races outside of the city. But yeah, that's pretty much it. Staying moving, reading, keeping my mind, going.
What kind of books do you like to read?
Usually period pieces.
Really?
Mm-hmm. Period pieces, fiction. But I'll do a balance between that and something a little bit heavier. So I like to kind of break it up and read 2 books at once. And so I'll kind of go back and forth between the two. And I have a thing where I don't like to end a book. So I will, that last chapter.
You let it go?
Either I'll let it go and I'm like, I just can't. Or it will literally it might take me 2 weeks to read up until the last chapter, and it might take me 3 months.
Why is that?
I think I'm just never ready for it to be over.
Dang.
And when it's over, it's over. It's done.
Right.
So, but as a young kid, I've always loved reading like novels, series. The longer the series, the bigger the book, the better.
Nice.
So I was a big Harry Potter.
I was just about to ask you.
Yeah, naturally.
I was just about to ask you. And I'll tell you a story about Harry Potter. I read the books when I was in boarding school, when I was in high school. And then it wasn't really that impactful to me. I was a Tolkien fan. So I loved the Lord of the Rings. So I read the Lord of the Rings, the Silmarillion, the Hobbit. Tolkien was just my guy. And then short stories, Arthur Conan Doyle, some of my favorites. Sherlock Holmes. Anything Sherlock Holmes. Arthur Conan Doyle.
Mystery kind of.
Yeah. I love that. You. So I read like the Hardy Boys, and for no reason, Hardy Boys, Nancy Drew. I read all those books.
That makes sense.
But Harry Potter, when everyone was talking about it, I read it, but I was just like, it's cool.
Oh my goodness.
And so I completely forgot about it so I never watched the movies. I only saw the first movie, like at some point when it came out. I think I watched it as a bootleg at the time. In any case, in recent years, so in the last 5 years, I went to Universal, and there's a Harry Potter world.
I heard.
And it blew my mind away.
The books, so if you've read the books, is the perfect depiction of what you see probably at it's the imagery in the book. I have not seen imagery better than the Harry Potter series. It's mind blowing. The detail,
my mind away. Even the way to get in.
Oh yeah, but it's all described in text. So when the movies came out, and I watched the movies, I already knew who was who. I knew where they were going. I knew because I could visualize it in my head from reading the books. But that's those types of books. As a young kid, kind of led me into reading more series now. So I think my latest series has been the Bridgerton series.
Oh, okay.
So I've been reading those prior to the movies coming out. But
man, I'm telling you, it blew so much so that after going to literally that day, after going to Harry Potter World, my wife and I watched like the first 2 movies, and in the span of 48 hours, we watched all 8 movies.
Naturally.
You just had to.
I
was like,
it makes sense.
How did I miss this entire time? And this is in the last 5 or 6 years. This is when this happened. And I'm just like, I read the books, but that really just transformed. So now when it comes on, if it comes on anything,
when you hear it, it's like, yeah, that's it.
All right. Just get me a nice little drink, sit down. It's Harry Potter time. I love it. I absolutely love it. Well, wow, this was awesome.
Yeah, this was fun. This is good.
Thank you so much.
No problem.
I really appreciate it. I think it's important to always have essentially a different point of view.
Yeah.
And a different way to assess and frame the field as we were talking about. And again, I'm left with much more appreciation for what you guys do. So thank you so very much. I hope you come back.
Yeah. And I appreciate the space to even talk about what I do, and to be able to talk to someone else in healthcare about it. So this has been great.
Absolutely.
Yeah.
Thank you so much. All right.
All right.
Not too bad, eh?
No, not bad at all.
How long do we go? Hey guys, thank you for watching this episode of The Last Zebra. We have new episodes coming out every Monday morning wherever you listen to your podcast. And on Tuesday mornings, the videos become available on YouTube. Please like, subscribe, comment, and share. And I'm looking forward to hearing and seeing you guys on the next one.